Did you know that Chris Bumstead underwent a hair transplant to maintain his signature look? We'll take a look at Chris's hair throughout the years, and we'll also take a look at his hair transplant. And in the latter half of this video, I'll draw out an alternative hair transplant design of how I might have designed his hairline if he came to me for surgery. In 2012, at the age of 17, you can see that Chris has proportional horizontal thirds. He also has a natural part on the left side of his hairline. And he has this straight hairline, which is very natural for a teenager. And notice that his frontotemporal corners are not round, but instead they come to an angle. In 2013, at the age of 18, we can see that Chris has temples that help frame his face. They reduce the forehead size laterally, because some people worry about the size of their forehead, and oftentimes they're just focused on the vertical height of the forehead as well as the diagonal height, but they're often forgetting about the lateral element of the forehead size. When we have our temples, they help frame the face and reduce the forehead size from that lateral component. And notice that Chris's anterior temporal peak is in line with the tail of his eyebrows. That's a very common landmark that we see, and we use that when I actually recreate people's temples. It's important not to go too medially with the temples when creating them surgically, because you can start to shrink down the face and things can look rather odd. But it's also important to keep in mind that as people age, sometimes the lateral hair of the eyebrow where the tail is starts to thin out, and it could be difficult to use that as a landmark. In 2014, at the age of 19, Chris has his hair pulled back here, and you can really see that part line better. So to the left of that part line, the hair has more of a left-sided directionality, and to the right of the part line, it seems to flow more towards the right. And that's something that, if done surgically, needs to be recreated, especially if one goes to lower the hairline. We also see here that Chris is starting to show some signs of a slight frontotemporal recession, and his entire hairline looks a bit higher than it was just a few years prior. In 2015, at the age of 20, I see no change. In 2016, at the age of 21, we can see that Chris's hairline shape is starting to change as his frontotemporal corners are receding further. And this is what moves people from a Norwood 1 to a 2 to a 3 as that curvature begins to change. In 2017, at the age of 22, I see no change. And that's the same through 2019. In 2020, at the age of 25, when we look at Chris's right temple, especially the upper portion of it, we see here that there's some scalloping developing. And all that means is that the temple is starting to look a bit more concave. And sometimes the right side actually recedes quicker than the left. We don't know exactly why that happens, but in about 90% of people, men and women, we see more recession on the right side of the hairline compared to the left. Also, I'm noticing that the frontal 1 to 2 centimeters of his hairline now appear to be thinner compared to, say, in 2015. And remember that around this age, around the age of 25, most men with androgenetic alopecia will start to have an acceleration of their hair loss. And that usually lasts for about 10 years, up until on average age 35, and then that hair loss will still continue, but at a slower rate. That's the common trajectory that many men will face, though of course other patterns and other trajectories are possible. Some guys as early as their teenage years will lose the majority of their hair and can become a Norwood 6 or 7 before the age of 20. And that of course brings up the concept of what's the ideal age to do a hair transplant. It's not the same for every person. If someone has a very advanced pattern early in life and they're willing to be on medical therapy, and if you're able to stabilize their hair loss, then you can consider a hair transplant earlier in life than you would for maybe another situation. So it's not just about the age of the individual, but of course we need to respect the fact that if someone starts to have advanced male pattern loss early in life, their odds of developing into a Norwood 7 type of pattern are very high. So they have to be treated carefully with surgery. So that's the type of patient where you really don't want to go too low on their hairline. In 2021, at the age of 26, we're seeing now that the frontotemporal corner angle is becoming more obtuse rather than acute. And that has to do with the central hairline receding back as you get more lateral, as well as the upper temple receding. And in addition to just routine androgenetic alopecia, remember that exogenous testosterone, which many bodybuilders end up exposing themselves to, can accelerate hair loss even more. And that's true at any age. I have many patients who present a bit older than Chris, and they come in saying, hey, I just started on some testosterone replacement therapy, and I'm noticing that my hair is starting to fall out, whereas it's been stable for many years. Why is that happening? And again, that's because of that testosterone increasing and starting to convert, at least in part, to dihydrotestosterone, leading to miniaturization of one's hair. And those patients on testosterone replacement or some other form of exogenous testosterone really need to be on finasteride more than your average patient if they're serious about preventing further hair loss. And I'd like to once again bring up feelconfident.com, where people can get affordable RX medications to help them keep their hair and also to thicken it. You can also find some really good thickening shampoo and conditioner to go along with your RX medications. These can optimize your hair follicle health, and as a co-formulator of these topical hair products, I can tell you that we put the very best ingredients in that are science-backed and have now been used by thousands and thousands of people from around the world that can attest to its benefits. We're also currently conducting a clinical study on our formulations, and we'll have those results available to all of you soon. In 2022, at the age of 27, I'm seeing advancing frontotemporal loss. It's the same general pattern that we were just discussing, but now it looks like it's becoming a bit more obvious. In 2023, at the age of 28, we see here that Chris has a thinning forelock. It's allowing more light to penetrate posteriorly on his scalp. And because of this, we can more easily tell the shape of his head from that frontal view. And we're now seeing towards the posterior frontal scalp and the mid-scalp when we take a look at his hairline. And Chris was very open about the hair transplant that he received in November of 2023. It looks like the harvesting for his hair transplant was done using the FUE method based on the marking design that I'm seeing here. They went with a very straight hairline design. And it looks like they went for about 1 centimeter of central hairline lowering, bringing him closer to the hairline height that he had when he was 17. I'm not seeing a whole lot of macro irregularity at the hairline. And it seems like the hairline was placed right at the uppermost forehead wrinkles. In a natural hairline configuration, remember that most hairlines will end up higher than the highest wrinkles of the forehead. And I'm seeing here some relatively high density surgical graft packing, maybe around 40 to 60 follicular units per centimeter squared. And from what I can tell, I think they may have placed somewhere between 2,000 and 3,000 grafts into that frontal area. We're now about a year out from Chris Bumstead's hair transplant. So let's take a look at the outcome and see what we can tell from the results. The areas that were transplanted still appear thinner than some of the more dense areas that he had naturally pre-existing the actual transplant. And this is very common. Anytime we work on an area that's more bare, there's going to be a limit to how dense we can make it with a single hair transplant. And part of that has to do with needing to leave some healthy skin around each graft in order for the skin and also the grafts to survive well. If you pack it too tight, you can run the risk of necrosis of the skin and actually poor graft survival because you need each graft to find its own blood supply. But if you put so many in, then sometimes they're not able to link up properly with the blood supply in the scalp tissue. You can always come back in with a secondary procedure to further increase the density of the transplanted zone. I'm also seeing a lack of single hair grafts right at the hairline. It's important to put at least a row or two of single hair grafts right at the front of the hairline in order to feather in the heavier grafts further back. If that's not done, then the hairline sometimes looks a bit pluggy and less natural. There's also, to my eye, a lack of transition from the central hairline out into the temples themselves. The hairline here does not exist in isolation. There has to be some way to connect to the hair laterally. If the connection to the temples or to the parietal area is not done in a smooth type of transition, sometimes you can see more abruptly where the transplanted hairs stop and the natural hairs begin. And that transition is particularly tricky because the temple hairs tend to be at a flatter, more acute angle, and they're usually running in a different direction than the rest of the hairline. So being able to create that transition is a very artistic process. We'll see how his low hairline fares over time, as there's always potential for additional hair loss. Hopefully, if he's on finasteride, he'll be able to prevent that hair loss from occurring, and then that hairline will hopefully be with him for years to come and will ideally makes sense with the rest of his hair appearance as he ages. So at this point, I think Chris has a number of options. One is just maintaining medical therapy, particularly finasteride and potentially even oral minoxidil, to both reduce further loss of hair and to thicken his existing hair. He can also consider increasing the density in the transplanted areas with another smaller procedure. But of course, this strategy will further deplete his donor area. So if he ever has a need for additional transplant work, let's say to the crown or to areas further back along the frontal scalp, well, now he may not have enough to give from the donor if an additional large procedure is performed into the previously transplanted zone. Trying to fill 1 centimeter that starts off fairly bare with really strong density that mimics the original hair can sometimes consume numbers like 800 to 1,000 grafts. Now imagine that's just for 1 centimeter. So the lower you start, the more of those centimeters you have as you go back. And donor areas after about 6,000 to 8,000 grafts usually look much more depleted. So you can do the math on that. If you're starting very low and you only have 8 centimeters of really strong density to fill, it's sometimes better to just not start that low in the first place. Let's say Chris decides that, hey, maybe my hairline is a bit low. I want to do something about it. Well, the options are a bit tricky, but one way to do it is to use laser hair removal for the hairs that you no longer want. But the problem there is that you're actually destroying those grafts. And so now you're not able to use those grafts on any other part of your head. But if you're trying to adjust the aesthetic, it might sometimes be worth it. Another option, of course, is to do FUE extraction of those transplanted grafts. But the issue there is that it will leave scars in the region where the FUE punching was done. And when those scars are present right at the hairline or now below the level of the actual hair, it can be somewhat visible and problematic aesthetically. And I do want to discuss a potential alternative design that might have been considered when Chris went in for the transplant in the first place. As we look at this 3/4 view of Chris's hairline before he underwent his hair transplant, there are a few things that come to mind. One is you can see where his hair is thicker out here, and you can see this kind of finer appearance to his hairline. So in deciding where to place the central point of his hairline, I would consider not placing it too low, but basically reinforcing just behind where his finest hairs are. So in my opinion, somewhere closer to here would be a more natural location for his hairline rather than dropping it by about 1 centimeter to match his 17-year-old look. As we start with his central hairline up where this blue dot is, we have to also see sort of where we're going to with the hairline, where we're ending up as we get out more laterally. And I think his temples overall look appropriate. So I would want to connect to somewhere up here where this blue dot is. And then it's about just creating a natural shape. What I try not to do is to go straight across with the hairline, which would look, something like this. In my eyes, that looks a bit less natural. And what we try to do instead is to create a little bit of this recession point and then come down towards this central dot that we've identified. By leaving this amount of recession here, it's not a whole lot of recession. It's not too significant, but it's going to give him a more natural look as he gets older. And then of course there's, some room here for negotiation, exactly how much recession, but this to me looks a bit more natural than going straight across. And then of course the area further back gets filled in up until we get to the heavier hairs where there's less light penetration. And something similar would happen on the other side. But I think some of the benefits of this type of approach is that it probably would have consumed fewer grafts. And I think it potentially would work well with his face and his hair overall, when he's in his 50s and 60s and beyond. If we were to reinforce Chris's temples, the way I would do that, you can see the lateral element of his eyebrow and somewhere around here. We would make sure that the anterior temporal point didn't pass any more medial, meaning you don't want to be any further medial in this direction than where that dot is. And we would have potentially created slight reinforcement because we talked about how the upper temple had scalloped. So, potentially reinforcing it, even though that's another contribution to grafts, would have been possible. And again, I'm not going straight up and down. You see, that would have been straight up and down. I'm creating a little bit of this tilt, right? This slight tilt that gives, again, that naturality and then connecting up to the rest of the hairline. So again, that would have been another approach as well. Okay, so now we're going to look at a bird's eye view of Chris's hairline. And again, we have to decide where will we be placing that central hairline point, right? So that midpoint. This image is not the most clear, so just bear with me, but we can still see that he has some finer hairs here, but the bulk of his hairline is starting a little bit closer to there. While you could make the argument for dropping the hairline maybe on the order of millimeters right around where those finer hairs are, I think starting the reinforcement somewhere around here would have been appropriate. And then again, not going straight across, which would look something like this, but instead deciding, again, how far lateral are we going? Where are we going to start to turn into his existing hairs? We want that lateral point to sit a little bit higher than that central point. So you can see that on the horizontal axis, this dot right here sits a little bit higher than that central one. And then basically we're creating a nice, natural, convex curvature that will bring us to that lateral point. So this to me looks like a very natural hairline design, and we will reinforce, of course, these frontotemporal corners. So that would be, I think, a very nice natural look. And, if someone wants to come down a little bit more, there's usually some room there, but avoiding that straight across look is typically what I like to do in the practice. Same thing on this side, we decide where would we have to go to have it be, first of all, look, relatively symmetrical with the other side. You don't have to make it perfectly symmetrical because, no two sides are ever going to be perfectly symmetrical. And plus it looks more natural when they're not fully symmetrical. And again, then we're going, onto the other side and filling in an area like this. And that to me, with, again, this view, I think would be a very natural, nice improvement without looking too artificial. I think an alternative is closer to maybe what they did for Chris, which was to drop by about 1 centimeter and design it in a more kind of straight across manner. While that maybe to some gives more youthfulness, that also presents some issues that we were talking about earlier in this video. Basically, from the center, you want it to be coming up towards that lateral connection point instead of just being on the same horizontal plane, right? So the same horizontal plane would have brought us down to about here, but instead we're connecting up here. Hopefully that helps you guys understand how I design hairlines and also how we like to create very natural appearances in my clinic. At the end of the day, we want our patients to be happy with their hair, not just in their 20s and 30s, but for many decades to come. That's why proper planning and execution matter in hair transplant surgery. It's not just about moving thousands of grafts around. For a more detailed analysis of factors that influence hairline design, please check out my video linked below. The most impressive physiques, like Chris Bumstead's, remind us how every detail counts. Just as bodybuilding demands precision, so does refining a hairline for optimized facial aesthetics. Thank you for subscribing subscribing to my channel and for supporting our Feel Confident brand.